Hey, this is Chris, keeping it real, facts over fear. How you doing this evening? Got a couple thoughts about this pandemic, and I hope by now we've all learned at least two things. I know I have. Number one is all the things that we've done to try to slow this virus down have proven to be ineffective. In other words, here we are in the middle of December, and we just had 8,000 new cases today in North Carolina. And you know, I'm not a fan of day to day, but it's way over last week, and the last 3 or 4 days have been over last week. So even if you're talking 7 or 14 day rolling averages, it's substantially up. And we would be in this territory regardless of what. Regardless, if we'd done nothing, we'd be in this territory. If we'd done even more, we'd still be in this territory. And it's just, you know, some things are just the way they are. I think, you know, obviously we've delayed some cases, and we've delayed some hospitalizations, and we've delayed some deaths, but the way it's looking right now, we're not going to get out of this without more. And today's has pretty much convinced me that, you know, I'm not trying to be alarmist or anything. I'm just, you know, trying to figure this out. And it's obvious I can't trust the CDC or the WHO, or I can't, or the governor of North Carolina. I mean, it's just nobody really knows, and yet we're here. And I think it was very telling at the press conference the other day that the governor did not institute any more restrictions, because I think there's a realization among everyone that it doesn't matter. This virus is going to do what viruses do, and no kind of lockdown or shutting down things early. I mean, yeah, some restrictions are still in effect, but you know, they're just, when they don't really affect about 95% of the population, then it really does, you know, I don't even know why we're doing anything, really, to be honest with you. One thing I wish we had done, and I'm very disappointed that we haven't done, was obviously we're still not doing anything to protect people in congregate living settings. And I mean people in elder care and nursing homes and things of that nature. They still make up nearly 50% of the deaths. If you're on the general population, the real number of deaths in North Carolina is about 2,500 for this whole time. Lots of cases, not lots of deaths, but I think that's a complete failure on the part of the Department of Health and North Carolina Department of Health and Human Services to not try to get a handle on that first, and then worry about the rest of us, because the rest of us don't have nearly the chance of dying as someone who's in a nursing home, because of course they're all old. And everybody knows that, you know, everybody should know by now. And the second thing I hope I've learned is that we all think we're a lot smarter than we really are. You know, every generation thinks, oh yeah, we figured things out and we can do what we want, and there's no challenge that we can't meet. Well, we've not met this challenge very well, and it's just because it exceeds our capacity to meet it. Now the vaccine might change that, and maybe we are on the cusp of being able to control one more small thing in the myriad of things that we face that can lead to you know, hospitalization and death, and even, you know, and those kinds of things. But we're not there yet. But you know, everybody's got this. Well, everybody I see on TV who's in the medical profession and you know, people in government seem to think, you know, we have all the answers. We don't have this. What this pandemic has proven, we don't have any answers at all. We're pretty dumb when it comes to a lot of things. We figured out a lot of things. We're just, you know, as far as knowledge goes, we're just, you know, scraping the top of the iceberg. And as far as wisdom goes, we're not even on the iceberg yet. So those are the two things I've learned. A little bit of humility goes a long way, and a little bit of realism goes a long way, I think. So I've learned to be a little bit more realistic, a lot more realistic, and a lot more humble. Those are the two main lessons I've learned. I hope, you know, what lessons have you learned during this pandemic? I'm talking about big picture things to learn. I'm not talking about little day-to-day. Well, of course it is day-to-day too. Big picture things. What have you learned about our society, about our human race? Think about it. If you have any thoughts, please leave your comments in the question and comment section below. Please leave a comment. Please leave a full comment. I'd really like to hear your thoughts. You know, that'd be nice. Like start a conversation. I think that's what we need to start doing. I mean, not necessarily with me, but we need to start having real conversations throughout society about this kind of events and what does it mean, what are we going to do, how are we going to handle it this time, how are we going to handle it when it rolls around again, you know, things like that. All right. Didn't mean to break you down. I hope I didn't, really. I mean, because, you know, there's nothing to be down about. It's just the way things are. It's better just to say, well, here we go. Let's deal with it. We'll see you on the next philosophical video.